Like I said, thank you everybody for joining us today. If you're here, it means you're interested in rhinoplasty. I'm going to pass things over to Kelly Oswald, who's our patient coordinator. She's one of our patient coordinators on our team here. She's been here for 9 years, so she knows anything and everything about rhinoplasty. And she's going to talk to us a little bit about Dr. Porter and the scheduling process, and then we'll get started.
Perfect. Thanks, Kat. Um, Again, I'm Kelly. I'm one of the patient coordinators here, and I have been here with Dr. Porter for the past 9 years. So I'm truly excited to talk to you guys about rhinoplasty today with Dr. Porter. As you know, she's a double board certified facial plastic surgeon, and she's been in practice for over 27 years now with over 15,000 procedures done. She specializes in rhinoplasty and revision rhinoplasty, and she truly has experience in all skin types. She focuses on more of natural and balanced results. She truly is an artist when it comes to coming up with your surgical plan for rhinoplasty and revision rhinoplasty. So we definitely are happy that you guys are here today with us, and we hope that you leave this webinar feeling informed and excited and want to take the next steps with us for rhinoplasty. So as I mentioned, she's also been voted a double board certified or a best facial plastic surgeon in Bethesda magazine and DC magazine. She's also been voted a top doctor. She's written multiple book chapters, and she's always giving presentations and talks on rhinoplasty and ethnic rhinoplasty. So you truly are in excellent hands with Dr. Porter. And why the experience matters. So rhinoplasty truly is a complex facial surgery. Even if it seems like, oh, it's just the hump or just the nostrils, there's a lot of complex with that surgery. So you definitely want to make sure you are in the hands of somebody who specializes in it. So Dr. Porter specializes in head and neck surgery only. Rhinoplasty is the #1 surgery that she performs. Same thing with revision rhinoplasties. It might seem like it's a minor change that you're looking for, but with that extra scar tissue there, you definitely want to be in the hands of somebody experienced, and definitely just a peace of mind. Dr. Porter makes everyone feel very comfortable. She's very calming demeanor, and everyone always says she has a great bedside manner. So you truly are in excellent hands with Dr. Porter. So I'm very excited for you guys to listen in and hear what Dr. Porter has to say about rhinoplasty and revision rhinoplasty. And now here is Dr. Porter.
Thank you, Kelly. Well, I appreciate everyone joining and tuning in to learn a little bit about rhinoplasty. But rhinoplasty comes from the Greek words rhino and plastine. Rhino meaning nose and plastine meaning to mold. And so the idea of rhinoplasty is to reshape or refine the nose. And traditionally, it was more of a trying to make it into one uniform structure. When I got into the specialty, I was drawn to the fact that I really don't think everybody should have the same nose. So I did some research initially, and that led me to refine my techniques and come up with my way of doing it, which I'll talk to you about today. So who's the ideal rhinoplasty candidate? You can see all these patients look very different, but clearly we want somebody that's physically healthy and mentally healthy with realistic expectations. And I think the consultation process is so key, just making sure that we're all on the same page about what the final outcome will be. The patient needs to have full facial growth, so definitely not a young teenager, somebody who has gone through menses or has reached their full stature. Ideally, non-smokers or have to be willing to quit before surgery. Smoking definitely impairs the healing process, and so we want to optimize that and quit prior to surgery. And you also have to be committed to following the pre and post instructions. We give so many instructions to everybody before, after the surgery, day 1, day 7, just constant touching base with patients, making sure they understand what's to be expected and where they are in the process. Next slide. So there are quite a few myths out there regarding rhinoplasty, and so we're going to talk about some of those. One is that all noses look the same after rhinoplasty. Um, and I can tell you in my hands, they do not. I like for each surgery to be customized to fit that patient's face. And so you hear me talk about natural a lot. Natural doesn't necessarily mean that you can't tell a difference. Natural means that it looks like a nose that belongs to that person. So we spend time during the consultation process making sure we're all on the same page about what the final outcome will be. Next myth is recovery takes months of hiding, and actually really only takes about a week. Most patients, when we get the cast off, and we'll show you some pictures later, people are able to return to their daily lives pretty quickly, whatever that may be. Some patients even will go to class or go to work with the cast on. I don't recommend that. It's best to give yourself some time to heal. If you work from home, that's fine, but you definitely need to wait for the anesthesia to get out of your system. Next myth, results look fake or overdone. So I end up doing a lot of revision rhinoplasties on patients that have been given this look by doctors, from around the world. But I do prioritize a balanced and natural result. So, you want it to not look like a caricature. You want to look like, a nice nose, but you don't want something that looks like a Barbie doll type of nose. And then rhinoplasty is painful, and I can tell you that most of my patients don't take the pain medication that I give them. And if they do, I give an arthritis medication, so it's not a narcotic. It's very well tolerated, and sometimes I do think it helps with the swelling and the bruising going away a little bit quicker, but most people will say they have like a little headache, and that it's really not too bad. So my philosophy, if you haven't figured it out, is to preserve your identity and unique features. We're trying to create harmony with your existing facial structure and your overall stature, making sure that everything looks good together. The focus is on form and function, so you have to be able to breathe out of your nose. That's why I'll never create a nose that is too small or non-functional. And we also want to achieve results that just enhance your features and not detract from them. Next slide. And so there are different approaches to surgery, and the approach is just how you get into the nose in order to do the surgery. So it's not a technique, it's more of is there an incision on the outside or is there not? And so this is a patient before and after surgery. And so the incision that's made is made right here where those little dotted lines are, right across the columella is what that's called. And that's just the bridge that separates the two nostrils. And you can see afterwards, if you look hard, you can definitely see the scar, but, to look at it as a whole, you don't. But what it allows me to accomplish is the definition that I want to get and other things, which we'll talk about later, but also making the incisions at the base of the nose to narrow the nostrils. You can see it falls into the natural nostril crease, and so it's usually very well disguised. Next slide. And then rhinoplasty techniques. So the techniques are the things that allow you to make the change. They're very customized. Some people want hump reduction or narrowing or tip refinement. There's a variety of things that people want from the outset. And so then I design the techniques that I think are going to give that result. And so that might be grafting, narrowing the bones, using different suture techniques to achieve the result that we're trying to get to. And so that's really beyond the scope of this talk because I talk about those things with my colleagues and write book chapters, but what I really need from you is to know what it is that you're trying to achieve, so then I can design the techniques in order to get there. Next slide. Kelly, you're muted.
Sorry about that.
Mhm.
Perfect. So for our consultation process, you will always start with a conversation with myself or Jessica, our other patient coordinator here. We'll start out with a conversation going over your goals, what to expect with surgery, kind of giving you a better idea of the price range. And then once you come in for your consultation, you'll meet with myself or Jessica and Dr. Porter. We take your photos while you're here. We also use a 3D imaging so that we can morph your photos and go over exactly what it is that you're looking for. You know, what do you like, what do you don't like, and really plan out the surgical plan with Dr. Porter. And then when you come in for your consultation as well, we'll also be booking your surgery and giving you the exact price once you come in for your consultation. So to prepare for your consultation, we always ask that you come in with a list of questions. Usually myself and Jessica try to answer all the questions before, but if you have any additional questions for Dr. Porter, definitely coming in with that. It's very helpful if you bring in photos of noses you like or don't like. Some patients will even morph their own photos before coming in, or if nowadays everyone has a filter or something. So if you like yourself with a filter, we always say that's the best way too, because that is truly your face. Definitely come in with a calendar. So Dr. Porter does book out 6 months in advance or so for surgery. So always want to come in with a couple dates that are in mind. You know, if you have any travel plans, any special occasions going on, school, anything like that, definitely come prepared with a few dates. And then it's always best to bring your support system. So if you have a parent, partner, friend, whoever it is, it's always nice to bring one person with you just so they can also meet Dr. Porter and kind of help answer any questions you have. It's a big decision you're making, so we definitely want you to feel the most comfortable. So bring someone with you, and if they aren't able to attend, we can always FaceTime them in or call them in during your consultation as well. So once we have you booked for your surgery, we will schedule a pre-op appointment. That's usually about 2 to 3 weeks before your surgery date. You'll come back into our office here. We'll review the photos, the morphed images that we had done last time at your consultation. You know, if there's any changes you wanted to make, you want more, less done, whatever it is, we are happy to do that for you. You will need to get cleared by your primary care doctor, so that has to be within 30 days of the surgery date. And then we will go over all the pre-op and post-op instructions. We give you the supplies that you're going to be using, like a saline spray and ointment. We'll bring all of that. We'll provide you with all of that, getting your pharmacy, and just going over all the instructions on the do's and don'ts for preparing and for after your surgery. And then the day of surgery, Dr. Porter.
Yeah, so on the day of surgery, you'll check in at the surgery center. All of the surgeries that I do are done at a surgery center that's certified. And on that day, you'll meet with me. Prior to the surgery, we'll go over everything. You'll sign the consent form. The surgery typically lasts anywhere from 1 to 3 hours. Most are about 2 hours. And then you'll recover in the recovery room for about an hour and then be able to go home. You'll have to have a ride home with somebody that you know, or if you don't know anybody that lives in this area, there are nursing services that can drive you home and stay with you overnight if that's needed. We have quite a few patients that come in from out of town, and so typically those people don't know anybody that lives around here. The initial night, you're going to sleep with your head elevated and get some rest. This is a picture of a patient driving to her appointment 1 week after surgery. And so you can see the cast is still in place. She's got some bruising in her upper cheeks, but overall, you know, looks pretty good. All right, next slide. And then that first week of recovery, the packing is removed the day after surgery. And then you're able to get some air through your nose. You'll start using some saltwater spray in your nose. The swelling and the bruising usually peak around day 2 or 3, and then they'll start to go down pretty dramatically after that. Pain, as I mentioned before, is not that significant, but you will have some pain medication to take if you need it. Sleeping with your head elevated definitely helps with the quick recovery. And limiting your activity. The more you get overheated, the more swelling you're going to have and the more uncomfortable you're going to be. So you really want to make sure that you take time to, you can walk around and do things like that, walk around the house, go outside. Some people go to the movies, but you will have a cast on your nose for all those things. So plan accordingly. If you can work from home, that is acceptable after about 48 hours. And you can see this patient here. It's 1 week after surgery. Cast and the sutures were removed, and obviously it's swollen, but you can see there's some initial changes compared to her before picture, and this will just continue to improve as time goes on. Next slide. And so the recovery, at 2 to 4 weeks out, the swelling's continuing to go down. You're able to return to your everyday activities. So if that's school or running the kids around or light exercise, work, it just really depends on the person. But patients are able to get back to the fun things that they want to do, like prom and graduation. And there's a gradual reduction in swelling during this time. You're able to put makeup on if that's your thing. Sun protection and skincare are a must. You want to just take care to not get too much sun on your nose so that it heals properly and you don't get a sunburn. And just having some patience with the healing process, knowing that it's not going to be straight linear decrease in swelling. It's going to go kind of up and down. And then once you get to the year point is when you're going to see more of a final result. Yeah, and the long-term healing, before there's, obviously in this patient, for instance, there's the hump. Hump is taken down. She didn't really want much done with the tip other than to elevate it a little bit. But there's continued refinement over time. Next slide. Okay, and so we'll go over a few cases. This is a patient that wanted her nose to look more aligned, a little bit more narrow in the nostrils as well. And you can see that her brow tip aesthetic line, the line that goes from her eyebrows down to the tip of her nose, looks a lot better on that 3/4 view.
Mm-hmm.
Next slide. And this patient wanted her hump to be gone, not so concerned with the tip. So we did just a little with the tip just to align it better with the dorsum, the bridge of the nose. And so here she's shown afterwards feeling good and looking good. And this is early, this is like a month after surgery. So it's obviously still swollen, but she was able to get back to her activities. And I think we have a selfie of her later.
Mm-hmm.
Next slide. And this patient, you can see before her nose is a little crooked. The tip is not as defined and the nostrils are a little bit wide for her face. Afterwards, the nose is slimmer, the hump is gone. And you can see how slimming the nose also makes the face look slimmer. It's like an optical illusion, but looks great, and she's very happy. Slide. And I appreciate all the patients that have let us use these photos. I think it's very helpful for people to see different patients, different types of noses, different outcomes. So that way you can kind of get an idea of the differences that are available. But this patient wanted more narrowing, more definition, and you can see that the nostrils are more narrow, the tip is more narrow, and that line again from her brow down to her tip is really nice and crisp. Next slide. And this patient had a hump and kind of a droopy tip, just wanted it straight, more aligned, and really liked the way she looked from the front, so not a lot of change there. Next slide. Yeah, and so now we wanted to save quite a bit of time for Q&A. So as Kat mentioned earlier, you can put questions in the Q&A and she's going to read them out and I'll answer them.
Awesome, great. Yes, so if you're joining from your phone, right underneath the reaction buttons, there is an option to submit a question. And then we also had some questions. Well, we had questions about that, but here are some of the questions that we've already received. Dr. Porter, we had somebody interested in understanding what kind of anesthesia is used during the procedure.
So I would say 99% of the time it's going to be general anesthesia. The only time I might do a local anesthetic would be if we're doing something so minor that really it's probably not even a rhinoplasty. You know, we're not breaking the bones, we're not doing any tip work, but it's going to be under general anesthesia in the operating room where it's nice and safe.
Great. And then we had a question about combining rhinoplasty with other procedures at the same time. So for example, a chin implant or an upper blepharoplasty.
Yeah, that is actually quite common. I have quite a few patients coming up in the next couple of weeks, I think, where we're doing rhinoplasty and maybe some fat grafting if they've got some volume loss, or doing upper or lower eyelid surgery in order to, you know, if they've got hooding on the upper eyelids or bags under the eyes. So it lends itself to doing other procedures at the same time. The chin implant is definitely something that's relatively easy to do at the same time because you're able to place the chin implant and balance the nose a little bit easier.
Right, great. And then we had a question about revision rhinoplasty. So we had a question asking about, is it possible to restore a primary rhinoplasty that resulted in a Barbie nose to a more natural appearance?
Yeah. So I like to call that type of revision like an undoing. I see quite a bit of this kind of extreme rhinoplasty results that just don't fit the face for whatever reason. So a lot of times in those cases, people have put in grafts to build up the nose or to rotate the tip up. A lot of times we're taking out the grafts and then sometimes repurposing them. It's almost like rearranging your furniture, but I'm able to use some of those grafts to accomplish my goals in supporting the tip or getting, you know, some tip definition, but not to the extreme, or, you know, decreasing the projection. There've been, you know, quite a few different types of surgeries that have needed to be done, but I am able to do it. And I would say this is something that has been more like on the rise in the past like 5 years or so.
Definitely.
Yeah. So
Thank you. We had a question about weight loss and the impact of the outcome of the surgery. So, somebody is currently losing weight. Would you recommend that they wait until they've reached their weight goal before moving forward with the procedure?
So weight for rhinoplasty is not as much of a concern. The nose doesn't really have fat in it, believe it or not. I mean, if it does, it might be like a little teeny tiny bit of fat, but it's mostly skin, cartilage, and like the muscle layer that's overlying it. So the weight does not impact it from that standpoint. But if, in fact, you're overweight and not a good candidate from a medical standpoint, it would be good to lose the weight and get to a safe space where, you know, you're not going to put yourself at risk for having complications after the surgery because of excess weight.
And then we'll take about 2 or 3 more questions. We had a question about traveling after surgery. So how soon can somebody fly home after their surgery?
That's a great question. So we have a lot of patients that come from not in the DMV, the District, Maryland, Virginia area. And so they're coming from, you know, across the country, around the world. And a lot of them will fly home the day after we get the cast off, which is usually like day 8 or so, day 9. Some people will stick around a little bit longer if they're truly coming from very far away. But, you know, you're fine to fly at that point. Typically, I will see people back at a month after the surgery, but some people go on vacations afterwards. So there's a variety of things. You just have to be careful with your nose when you travel and make sure you don't accidentally get hit in the nose.
All right, and then we'll take 2 more questions. We did have a question about using cartilage from the ear and the rib. How common is that, and how will somebody know if they need that done?
Somebody will know if they need that done if I think they need it. So that's not something they have to worry about. Really, it comes down to, you know, assessment, examination, finding out the desires and what you want to get out of the surgery. And then based on your anatomy, I'll look at everything and give you my thoughts about what cartilage is needed. Sometimes we'll use cadaver rib cartilage, and some people kind of flinch when I say cadaver rib cartilage, but it's actually very safe. What's nice about it is that it's already harvested, cut, and so it doesn't undergo warping like rib that you would take from yourself. You know, the rib from your own body is great, but it can warp and bend and do things after it's put into your nose. And so when that happens, then you have to take it out and reconstruct the nose. And as we have in a patient that, you know, we've seen in the past. So.
All right, great. Well, Dr. Porter, thank you so much for answering these questions. We are going to move on there. Pass it over to Kelly in just a second. There were a few questions about scheduling and pricing. So this is a perfect segue because Kelly's going to jump in and kind of address the next steps on how to get those answers. There were a few other questions about specifics regarding your specific case, and Kelly can talk about how to get those answers. Let's go ahead.
Perfect. So next steps, we definitely have limited space available for surgery. So if it's something you've really been thinking about and ready to move forward, we are happy. And even if you're kind of in the beginning process of, you know, just getting questions answered, we are happy to talk with you. So myself and Jessica, our other patient coordinator, are going to be available for some calls. So if you haven't already, you can scan one of these QR codes below for either for myself or Jessica. We have some different times available, so you can see which time works best for you. So schedule a call with us. We're happy to talk with you. And if today or tomorrow doesn't work for you, we will have some more availability next week. But just let us know. You can email us directly or set up a time through those links. And if you haven't already, you can also submit your photos. We will reach out to you and send you the link for that, where you can upload some photos, and Dr. Porter will review them complimentary for you and kind of give you a initial assessment, and we'll be able to narrow down the pricing for you based on your photos. So we appreciate everyone coming and joining our webinar today. Again, if you have any additional questions, you can call the office or you can email us directly.
All right.
Thank you so much for joining us today, everybody.
Thanks, Kat.
Thank you, Dr. Porter.